Following conception and continuing until childbirth, there are many metabolic, anatomic, hormonal, psychological changes that take place in the mother. First, there are numerous steroid hormones, peptide hormones, and prostaglandins influencing the course of the pregnancy. Progesterone and estrogen have a particularly strong effect, so we're going to talk about those too. So you can see progesterone promotes the development of the endometrium and relaxes the smooth muscle cells of the uterus. This helps the uterus expand for the fetus as it grows. It helps prevent premature contractions. It also is going to slow down GI motility since the GI tract is smooth muscle cells. And then estrogen is going to promote the growth of the uterus and the breasts and make the connective tissues in the pelvic region more flexible in preparation for birth. The relaxation of smooth muscle is going to affect the GI system. It's going to cause constipation, heartburn, delayed gastric emptying, but it's also going to help increase the absorption of iron and calcium, two very important minerals. The BMR can increase by as much as 15 to 20% by term. This is caused by the increased oxygen needs of the fetus and the maternal support tissues. The fetus prefers glucose as its primary energy source, so changes occur in the mother to use fat as the primary fuel source. For a woman with a normal BMI, we would want her to gain 25 to 35 pounds. If she is classified as being overweight, we'd want her to gain 15 to 25 pounds. If she is underweight, we actually want her to gain extra weight, and so we want her to get between 28 and 40 pounds. What is the reason for all this weight gain? Well, the plasma volume doubles during pregnancy, beginning in the second trimester. This is going to dilute the blood. Another reason why we need so much more iron. The weight gain is primarily due to water. Up to 7 to 10 liters of water is gained during pregnancy. The mom's body changes. Example, like the increased plasma I just talked about in the fluid volume. Also, her support tissues increase in size. And then lastly, you have the actual fetus and placenta. Which groups of women who can become pregnant would you want to focus on appropriate weight gain? That would be women who are overweight and obese, about how they need to gain less weight than we normally expect. But then also those who are underweight, like teenagers, potentially avid exercisers, and women with weight issues like a history of anorexia are going to have a hard time, even if their BMI is the normal range. So they're going to have a hard time being told they need to gain 25 pounds. Here you can see our common pregnancy complaints that we're going to talk about each individually. Okay, hemorrhoids. These you can see because the relaxation of the gastric sphincter may occur. Oops, I said hemorrhoids, but I meant to say heartburn. My bad. Anyways, it's the same thing. Because the relaxation of the gastroesophageal sphincter may occur, which is smooth muscle, reflux is going to result. The patient needs to get MD approval to take antacids, even over-the-counter ones. Excuse me. And here are our interventions to help with the heartburns. So smaller, more frequent meals and avoiding those things that can cause or can make the heartburn worse, like the fatty, fried, spicy foods can help. A really big one is, we talked about with GERD, is not lying down after eating. Constipation. This responds very well to dietary treatment. So we see it happens more commonly in the first trimester because of progesterone, and then in the third trimester it's because of the growing fetus, and so that ends up crowding the abdominal organs. So the big three that we do is increase fluid, increase fiber, as well as increasing exercise. So the fiber we want is going to be insoluble fiber to help with constipation. And moderate exercise, what we mean there is like a daily walk. Nausea and vomiting, also known as morning sickness, because it's most common to happen between 6 a.m. and noon, but it can happen anytime. The etiology or the cause is unknown, but stress and fatigue may exacerbate it or make it worse. We often see it in the first 3 months of pregnancy. And so you can see here we have a nice long list of important interventions to help with the nausea and vomiting. So eating crackers or dry toast before getting out of bed can help. We also want to teach the patient to avoid sudden movements, eating those smaller, more frequent meals so that they never become hungry, because that can actually make it worse. So we always want them to have a little bit of something in their stomach. Drinking fluids between meals instead of with meals so they don't get too full feeling. Avoiding again the greasy, fried, seasoned foods. Decreasing coffee intake. Encouraging rest, because we know that fatigue can make it worse. We want them to see the doctor if the mom cannot retain fluid or food for 6 hours or longer. All right, cravings. So pica is associated with iron deficiency, and it's characterized by the need to, or the want to eat ice, cornstarch, clay, dirt, all these things that do not contain any iron. We do see it more common in African American women, but it has been seen in all ethnic groups. Hemorrhoids. So especially in the last months of pregnancy, this can more likely to occur in the mom because of the increased weight of the baby on the colon. If we prevent constipation, we're going to decrease straining, which is going to decrease the hemorrhoids. So the best remedy again is going to be fluids and fiber. Now let's talk about what are the energy needs of the mom while she's pregnant. So some estimate that you'll need between 68 and 80,000 calories over the 9 months. So how do we get some extra calories in? Well, in the second and third trimester only is when we're going to have them eat an extra 300 calories per day. They do not need any in the first trimester, as well as we really do not want to use the phrase eating for two, because when you hear eating for two, the mom thinks she should double her intake and she really only needs an extra 300 calories, so like an extra sandwich in a day is all the extra that she needs to complete. Protein needs are highest for pregnant women, higher than what an infant or an older adult or an adolescent needs. So we need to make sure that the mom is getting enough protein in. She's going to need 71 grams of protein versus 46 grams for the non-pregnant women. So you can see her needs are almost going to double because she's making so many new cells. The vegan dietary pattern can provide all essential nutrients except for vitamins D and B12. So we want to encourage the vegan mom to eat foods that are fortified in vitamin D and B12, or some functional foods, and then she should be fine. All right. This is actually a vitamin, not a mineral, so this should really see vitamin needs during pregnancy. Sorry about that. Is folate. Folate need intake increases to 600 micrograms. You and I, who are not pregnant but are but of our childbearing years, need 400 micrograms a day. And actually, here you can see we actually want synthetic. So we actually want them to take it as a pill or a fortified food. And I want you to think, why is that? And the United States Public Health Service recommends that all women capable of becoming pregnant take in at least 400 micrograms a day. We need this for added protein synthesis during pregnancy, um, because folate is going to help with that. We can eat things like fortified grains. Then mineral iron. This is going to increase to 30 milligrams a day. Some say 27. Either way, they're very close. This is going to increase from the 18 milligrams a day we needed before we were pregnant. This can be difficult to obtain in the normal diet, and so we will need to supplement with an iron supplement to prevent iron deficiency anemia, and this will be in the prenatal vitamin. And again, this is important because I talked about earlier about how the plasma volume doubles. So anemia can be caused by the increased maternal blood volume. If it's not corrected, then the oxygen supply of the fetus will be impaired. The last mineral you can see is calcium. These needs are unchanged during pregnancy. Why do you think that is? Well, if you remember at the very beginning, we talked about how GI motility decreases. Your body gets better at absorbing iron and calcium. The bioavailability of those increase. So, however much calcium you need based on your age and gender, as in an adult woman needs 1,000 milligrams a day, whereas a teenager needs 1,300 milligrams a day. That is how much calcium you need. Here's a list of things that you want to avoid. You can really read this on your own. You can see about the caffeine that about 2 cups of coffee a day, they saw no increase in spontaneous abortion or preterm labor. Drugs, obviously all drugs, but be it prescription street or otherwise, should not be consumed without first being okayed with a doctor, even over the counter. But then specifically this drug right here can actually cause malformations. Alcohol, there's fetal alcohol syndrome, so all alcohol should be avoided. Tobacco should also be avoided because it can impair intelligence and decrease attention span, as well as increasing risk for SIDS, stillbirth, low birth weight, prematurity, attention deficit. And then lastly, there's soda, diet soda specifically, if it's sweetened with aspartame, because again, the fetus may have PKU. All right, now let's talk about some foodborne illness. This one's called toxoplasmosis. This is caused by a parasite found in undercooked meat and cat feces. If the pregnant woman becomes in contact with this in the first trimester, it can cause damage to the fetus's eyes or brain. So we want to, cook our meat, especially pork and poultry, thoroughly. Avoid raw meat, period. Wash our fruits and vegetables. Wear gloves when you handle the cat litter box or let someone else clean the cat litter box. About 85% of pregnant women in the United States are at risk of being infected with toxoplasmosis, according to the American Journal of Epidemiology. So it's very important that we cover this type of foodborne illness with our pregnant client. Listeriosis. Pregnant women are about 20 times more likely to get listeriosis than any other healthy adults. 1/3 of all listeria cases, according to the CDC, occur in pregnant women. So this is another foodborne illness that must be discussed with your pregnant client. You can see it's caused by listeria, the bacteria that we talked about. It can be found in soil, vegetation, water, and dairy products. Again, what I said before is what can be so I guess bad about this is it looks just like flu-like symptoms, but it ends up causing a miscarriage and premature labor. Foods to avoid. Basically, we talked about this already. The deli counter, luncheon meats, hot dogs, soft cheeses like brie and feta, raw milk, raw or undercooked meat. Wash all salad ingredients before eating. All right, here is a nice list of the benefits of breastfeeding. 60% of moms are breastfeeding upon discharge from the hospital. By 5 to 6 months, only 20% of American infants are breastfed. From 0 to 6 months, breastfeeding should be the primary source of nutrients. Here are some tips on how to successfully breastfeed, how to help provide. We don't want to separate the mom and baby following birth except for medical reasons. We do not want to do supplemental feeding unless medically indicated. And we want to encourage frequent breastfeeding, especially during the first days postpartum, and offer breast milk about 10 to 12 times per 24 hours at about 10 to 15 minutes per breast. So you can see the new mom, like the majority of her time is going to be breastfeeding. Culture plays a strong influence on breastfeeding. It's common in some cultures like Chinese, Finnish, Indian, Saudi Arabian, Muslim, South African, and Swedish. But then other cultures, it's not quite as appropriate. In our culture, it's not quite as prevalent, and that's something that we really want to try to change. All right, the average woman can produce 750 to 1,000 milliliters of milk a day. This means she's going to need to increase her energy intake by 500 to 800 calories a day. Going to need to increase her fluid intake of water or juice, and increase her protein intake. Lastly, she's going to need to increase intake of most vitamins and minerals. Folate now is at 500 micrograms. The mom does not need to avoid certain foods unless a problem occurs. Like some infants are fussy following mother's consumption of gas producing vegetables such as